Strokes are classified as one of the most traumatic brain injuries and cause of serious long-term disability in the United States.
Strokes have progressively increased to the fifth leading cause of death in the U.S. 73% of U.S. citizens are unaware of their own stroke symptoms and are unable to help in an emergency stroke situation. When picking this topic, we had several questions to consider.
A few are, what is the official definition of a stroke? What is the most common type of stroke? And what is a transient ischemic stroke? As part of our investigation, we decided to contact a neurological resident, a stroke specialist, and 2 medical students from the U of A. Through our research, we asked about new topics in relation to strokes.
So the definition is any type of damage to the brain parenchyma or the brain tissue that causes a decrease or stop in the blood supply.
A stroke is where part of your brain's not getting perfused.
So the official definition of a stroke is when the brain has a reduction or an absence of blood flow to the particular part.
There are 2 main types of strokes that can occur, ischemic and hemorrhagic. Ischemic strokes occur when a clot prevents blood supply to an area of the brain. They can further be divided into 2 categories, thrombotic and embolic. Embolic strokes occur when a blood clot forms somewhere besides the brain, such as the neck. Hemorrhagic strokes are a brain injury that occur as a result of weakened or damaged blood vessels. This causes blood to form around the brain and increase the pressure of the brain surroundings, therefore damaging the brain tissue.
Ischemic. They're mostly ischemic. Those are the ones I see the most. So hemorrhagic is a little bit different, but it's usually due to really high blood pressure, but most of the time it's ischemic. I would say 80% of the patients I see are ischemic strokes.
That's a stroke that kind of goes away. So what happens is you have a vessel that has a little bit of a clot in it, but then somehow your clot can move, get dislodged, and your symptoms resolve.
If someone's hemorrhaging into the brain, they're going to be causing a lot more pressure, so they're more likely to complain of a headache, nausea, vomiting, things like that, and also their symptoms will get worse as time goes on, whereas somebody with an ischemic stroke, their symptoms will be worse in the beginning and then kind of start getting better as the brain starts to perfuse a little bit better.
There is no time to go home, to wonder if the symptoms are going to get better. Time is brain when it comes to brain damage. So every minute counts, and it's important that we call 911 in these signs of stroke so that the ambulance, the paramedics, can deliver a person to a hospital where they can quickly and assuredly detect a stroke and put into action any treatment plans.
We then asked Reina Mosavi the same question, and she responded with a similar answer and the same phrase, time is brain.
Time is brain, it's one of those things. Is we have interventions, neurosurgery can come in and they can find the clot within 6 hours. If the patient had the stroke, we come in, you can remove that. The longer it stays in there, the more brain tissue is dead.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
There are several methods in resolving a traumatic stroke. Upon entering the hospital, TPA is typically administered to stroke patients. TPA stands for Tissue Plasminogen Activator and converts plasminogen into plasmin in order to break up blood clots. Occasionally, antiplatelet medicine is injected into patients to break up clots throughout the blood flow. Interesting enough, aspirin is a commonly used medication because it acts as a blood thinner to the expanding clots. If the clot continues to grow, intra-arterial thrombosis procedures may be immediately performed on the patient. A device called MRCI can also be used to break up blood clots in the brain as well. MRCI stands for Mechanical Embolus Removal in Cerebral Ischemia and acts as a stroke agent by removing the blood clot through the catheter.
As we continued to research strokes, we became more knowledgeable on the dangerous brain injury that occurs every 4 to 5 seconds. After gathering all these statistics and facts, we are left with these remaining questions.
How can TPA effects be reversed to stop further bleeding of hemorrhagic strokes?
How can oral contraceptives be refined so that they do not result in hypercoagulability?
How can the public become better educated in recognizing stroke symptoms and decrease the death rate of strokes?
Dr. Wayne Dwyer once said, "The ultimate ignorance is the rejection of something you know nothing about yet refuse to investigate." We hope to continue our investigation through research journals and by inquiring medical professionals who specialize in neurology.
Through asking questions, we were able to discover new stroke symptoms, recovery techniques, and basic anatomy of the brain. Through asking questions, we were exposed to new research that allowed us to inquire even more.